we know how detrimental smoking is to your health, but we have also learned throughout the pandemic how much worse it can be for a smoker if they contract COVID-19. Joining us to talk about this, because he is focused on this particular topic, is Dr. Scott Leisho. He is the Director of Clinical and Translational Science at Arizona State University. Dr. Leisho, thank you so much for joining us.
Great, thank you for having me.
So let's talk a little bit first about that correlation between smoking and COVID-19, because we know that the stress, the anxiety of the pandemic has also caused more people to pick up the habit.
Yeah, it's a real challenge. In fact, a study just came out about a week ago that really definitively showed that people who smoke more are more likely to have to be hospitalized if they develop COVID and develop more negative outcomes.
And the focal point here is, I would imagine, is the lungs, your lung power and capacity. And we've seen with COVID, people having to end up on those ventilators or at least oxygen.
That's certainly the lungs are really important, but the one thing that we know about smoking is that it has a system-wide effect. It affects every organ in the body, and it has impact. It impacts the lungs, the heart, and the full cardiovascular system, our immune system, which of course is really important with respect to addressing the body's addressing COVID.
The American Lung Association just came out with their annual grades for each state and how they handle smoking cessation, access to materials to start quitting. In Arizona, they gave us a D when it comes to coverage and access to quit tobacco. And so you're working on that right now with a new trial to help people kick this habit. Tell me a little bit about how it works.
Sure. So, there are multiple medications that are available to help people quit smoking, as well as there's behavioral support. The challenge is that there's not been a new medication for smoking cessation in over 10 years. So we're studying a new potential medication to help people quit smoking. It's called cytisinicline. It's similar in some respects to Chantix or varenicline. But what's interesting about cytisinicline is that it's a naturally occurring substance. It actually exists in plants in Arizona and other places around the world. And the cytisinicline works by suppressing the withdrawal symptoms when a person is trying to quit smoking. So we're looking for participants who are regular smokers, who are dependent smokers who want to quit smoking, who are relatively healthy. If a person's getting treatment for cancer or had just had a heart attack, we can't take them in.
I know you've already started tracking patients and you're going to continue to take participants for the next several months. How long will you track them, and is there any compensation?
They can actually be compensated $1,950 for the time that they would have to spend and coming in for regular visits once we start them in the study. We're following people every week for about 12 weeks, and then we do some follow-up visits out till 6 months. We want to find out if this medication works kind of long term. So we are looking at side effects and withdrawal symptoms and whether it actually helps people to quit smoking.
And it seems the goal would be to get this approved so that it is available over the counter or as a doctor's prescription, particularly for people who haven't had success quitting before.
Absolutely. And your point is such a good one, because we know that most smokers who ultimately quit have tried to quit multiple times before, and it's a challenge. And they've tried different medications or behavioral approaches and so on. So we're hoping that this becomes the next new approach that can help people finally get off that addiction.
How can people sign up if they're interested in participating?
If they call 775-476-2360, then we would do a phone screening to determine whether they might be eligible for this study.
Dr. Leisho, we want to wish you luck on your clinical trials and thank you for letting people know how they can get involved.
Wonderful. Thank you so much for talking with me, and certainly we look forward to helping as many people as we can.